Your period is late and your pregnancy test is negative, but you feel something is off. I totally get it. Here's the truth. Pregnancy is not the only reason why your period can be late. There are several other medical reasons that could be why. And sometimes, many of these reasons, a lot of women ignore them. Hi guys, welcome back to this channel. I'm Dr. Asiya, and as usual, we'll be breaking down common health issues we experience. So, if your period is late and you're not pregnant, you really need to listen to your body and understand what your body is trying to tell you. First, let's quickly understand something very important. Your period doesn't just come randomly. It's regulated by a very delicate hormonal system, which include the hypothalamus and pituitary gland in your brain, your ovaries, both of them, your uterus, also known as the womb. So if your period is late, it means that something has disrupted this hormonal system. And there are lots of factors that could have caused it. It doesn't mean that there is something wrong with your womb. We'll be starting with stress. A lot of people feel that stress is just something emotional, but medically, stress can affect your cycle. So when you are stressed, a signal is sent to the brain, which then triggers the adrenal gland to produce the hormone called cortisol. This cortisol is then released to regulate the stress level. So when the cortisol is high in the blood, this sends a feedback to the brain. This high cortisol interferes with the conversation between the brain and the ovaries, and then ovulation won't occur. Without ovulation, you can't have your period. So even if physically you look okay, you're handling the stress, you look like yes, you got it all covered, medically, the stress might be affecting your menstrual cycle. Another thing that could also cause a delayed period is excess body fat. Excess body fat leads to high level of estrogen, which in turn signals the ovaries, and the ovaries do not release an egg, and ovulation does not occur. Same excess body fat is one of the causes of insulin resistance. You can scroll down through my channel. I have a video where I explain insulin resistance and its role with PCOS. So insulin resistance is the major cause of PCOS, and once you have PCOS, you want to be ovulating on a regular basis. And that's why you might see your period this month and you might not see it next month. Sometimes your period is not late, it's just that your ovulation is late. Period usually comes 14 to 16 days after you ovulate. So if your ovulation is a bit delayed, your period will automatically be delayed. So sometimes you just have to wait it out for a few days or a week and see if your period still doesn't come after that. Late period could also be a sign of underlying issues. Two common underlying issues such as hyperprolactinemia and hyperthyroidism. Hyperprolactinemia means high level of prolactins in the blood. This prolactin is a hormone that's only meant to be high in lactating mothers, meaning when you are breastfeeding. When this prolactin is high in the blood, it sends a signal to the brain. Then the brain releases the hormones that tells the ovaries that, hey, the hormone you need for the maturation of eggs, we won't be producing that. It's suspended because of this high prolactin. And when there is no matured eggs, the ovaries has no egg to release for ovulation. Ovulation is when the ovaries release an egg for fertilization to occur. If there is no matured egg, the ovaries does not release anything. And when there is no ovulation, you do not see your period. Causes of this hyperprolactinemia can be a tumor in the brain. It can also be due to prolonged use of antipsychotic medications like risperidone or antiemetic medications, meaning medications for nausea, motion sickness like metoclopramide. We move on to hyperthyroidism. Thyroid gland is a gland in your neck. Hyperthyroidism is when this gland is overactive. When this gland is overactive, it releases some proteins. These proteins bind to the hormone estrogen, preventing estrogen to be released into the circulation. And the ovaries need estrogen for ovulation to occur. So without this estrogen, ovulation will not occur and you might not see your period. Hypothyroidism has also been linked to the cause of hyperlactin in the blood. So these two underlying conditions could also be the reason why your period is late. One common thing that's underrated is excessive exercise. Excessive exercise is you putting a physical strain to your body, and that is stress. And like I said before, stress could disrupt your menstrual cycle. So you have to exercise at the pace that your body can adapt to, not overworking it. Having a late period does not necessarily mean that there is a problem, but you should consider it being a problem if your period is 2 to 3 months late, if it keeps happening frequently, or if you start experiencing symptoms like increased weight gain, facial hairs, increased acne, or even severe pelvic pain. So, what's your take on from this? What you should do when you notice that your period is late? You can wait a few days or a week, repeat the pregnancy test. If it's still negative, then you go and see a doctor. You can also track your cycle, avoid stress as much as you can, and maintain a healthy weight. If this video has spoken to you in any form or it's beneficial for you, then you are the one I'm making this video for. Do not forget to subscribe, like, share to your friends and family. Also, you can follow us on other social media platforms like Instagram, which is siya_series, and on TikTok as Scrubs and Stories. See you in my next video. Bye.